What if the biggest threat to your doctor's ability to care for you isn't a disease, but the mountain of paperwork that comes with it? For every hour a physician spends with a patient, they spend over double that on documentation. This burden is a primary driver of physician burnout that we've seen across the United States because it forces clinicians to sacrifice personal time for what's grimly called pajama time by catching up on notes. But what if an algorithm could lift that weight? Artificial intelligence is being rolled out in clinics across the country right now, promising a revolution, but also raising urgent new fears. Can we really trust an algorithm with our health? Is it safe? Today, we're digging into how these powerful tools are used and what evidence says about their safety, and how we can navigate this new world in medicine without putting patients at risk. The first wave of medical AI isn't about replacing doctors. It's about augmenting their experience by taking on the most draining parts of the job. The most promising of these tools are ambient AI scribes, which can listen in on patient-clinician conversations and generate a medical note. A study in JAMA Network Open found that these tools significantly cut down documentation time and after-hours work, giving doctors more face-to-face time with their patients. And the scale is massive. A rollout at the Permanente Medical Group involving thousands of physicians saved nearly 16,000 hours of documentation time in 1 year. For doctors, this is a lifeline, with early pilots at major health systems reporting significant decreases of physician burnouts across the board. Beyond listening, these medical AIs are also learning how to read. By read, I mean they're learning to sift through medical documentation to give a patient's entire history to a clinician in just a quick summary. In the chaos of emergency departments, AI is also being tasked to help with triage. While the evidence is still evolving, some AIs are also being used to identify patients with critical illnesses at a high degree of accuracy, helping to prioritize care and optimize results. While the promise is hard to ignore, the question remains, is it safe? The answer is kind of complicated. In fact, the patient safety organization ECRI named risks from AI-enabled health tech its #1 hazard for 2025, warning that poorly built or managed AIs can increase the risk of misdiagnosis. The first big risk is algorithmic bias. An AI is only as good as its training data. If that data reflects existing health disparities, the AI can learn and even amplify those biases. Then there's the risk of errors and hallucinations, where an AI generates plausible and false information. Studies show that AI-generated notes often need a load of editing. This highlights a significant rule that all AI output must be reviewed, also edited and signed off on by a clinician. This leads to the question of oversight. The regulatory landscape is struggling to keep up with the scramble that is AI, with the FDA now emphasizing transparency and performance monitoring. Although AI scribes that draft notes have less scrutiny than AIs that perform medical diagnoses. In response, health systems are creating AI oversight boards, which are multidisciplinary boards to vet and to monitor these new tools. Finally, there's privacy. Medical data is some of our most sensitive data. So realistically, these health systems need ironclad agreements with vendors in order to make sure that patient data is at the center of what they're doing. So how can a health system start using these tools safely? It begins with a smart step-by-step approach. The journey should begin with the lowest risk, highest reward applications. That, in my opinion, being ambient AI scribe. Health systems can pilot these tools in clinics drowning in documentation, primary cares, ERs, urology centers, and carefully track the impact on efficiency and clinician well-being. It's also vital to be transparent about its limitations as of now. The huge efficiency gains aren't always immediate. There's a ramp-up period as clinicians learn to work with the technology. Crucially, the message to clinicians must be one of control. These tools are assistants, not replacements. That means the AI proposes and the human decides. This human-in-the-loop model should be the most important safety rail in medicine. And for health systems, it should be all about governance. Create an oversight committee, hold vendors accountable, and build a culture where doctors are empowered to question an AI's output and report further error. The integration of artificial intelligence into our medical care is happening right now. If you're a clinician watching this, what are your biggest hopes for AI? What are your biggest fears? If you're a patient, how do you feel about AI listening in to your appointment? Share your thoughts in the comments below. Your voice is essential in shaping where this technology goes next.